Senate Majority Leader Mitch McConnell says he'll bring the Senate Republican health care bill to the floor this week, just days after it was unveiled. The bill would end the individual mandate to buy health insurance and would reduce and eventually eliminate federal funding for the Obamacare Medicaid expansion, leaving it up to states to fill in that gap. It allows states to seek waivers so they can drop services currently required, like maternity care, substance abuse benefits, and mental health treatment. It repeals taxes put in place to pay for Obamacare and also rolls back some tax credits currently given to help individuals buy insurance. Republicans need 51 votes to pass the bill, or 50 if Vice President Mike Pence casts the tie-breaking vote. But 5 GOP senators say they can't vote for the bill in its current form, which is more than enough to kill it. Kentucky's Rand Paul summed up one side of the GOP opposition.
I just didn't run on Obamacare Light.
While Nevada's Dean Heller voiced another.
I cannot support a piece of legislation that takes insurance away from tens of millions of Americans and hundreds of thousands of Nevadans.
That means Leader McConnell is going to have to find a way to change the bill to attract more votes from conservative members without losing too many moderates. Senator Manchin, I want to get your response just first to the bill and whether you think there's anything you can do to improve it.
Oh, John, there's a lot that can be done to improve it, and we've identified, let's sit down, but we can't even get in the room. If Mitch would just expand to a bipartisan working group to repair it and quit talking about repealing it, we'd have a pathway forward. I think we could fix it. There's some good people on both sides of the aisle that know it needs to be fixed. There is not one person in West Virginia that's not been touched by the bill that was sent by the House, which was horrible, and the bill they have now, which makes it even worse. So I've said, work with me, don't work against this. They've proven they're going to need Democrats to pass this. And if Mitch doesn't have the votes, call off this bill right now and let's sit down and start working toward repairing the basic concept of what we have in the Affordable Care Act. We're willing to do that, John.
Let me ask you specifically, Senator, though, on this bill and the theory that perhaps Senator McConnell is not likely to call the whole thing off, what in it do you think it needs improvement, and is there any chance that it could be improved?
Well, sure. First of all, the private market, John. You can't force people to buy a product, and then if they don't buy it, you fine them. And I knew that was a mistake from the get-go. I wasn't there in 2010 when they passed it. They did go through an orderly process. Everybody had input. At the end of the day, not one Republican voted for it. There should have been a way for us to sit down and say major pieces of policy such as this, and that's the reason for the purpose of the Senate having 60 votes for cloture, is to get bipartisan buy-in. Now they're going to get rid of it with not one Democrat. And John, if they don't have me sitting down, someone who's in the middle, who wants to work with them to get good policy, they're in serious problems. The private sector needs to be fixed. The product and the market need to match up. John, they expanded 20, go ahead, I'm sorry.
Has the White House reached out to you at all in this process, or Senator McConnell?
No, not yet, no. Some of my colleagues have. Susan Collins and I have been speaking about it. Bill Cassidy and I've spoke about it. And I've told him, I said, if you can take repeal off the table, sit down and talk about repair and fixing what we have and how to make it better, I'm in with you. And I said, we'll get more Democrats that'll sit down. And Chuck Schumer says, if we can get a repair organization or repair group sitting down, that's fine. So we're not hindered from our side whatsoever, but this is about our country, and it's about, you have to have a policy that gets your people healthier, gets them in a productive workforce, if you will, and we're going to do that by intervening. We've given 20 million people health care without one word of instructions. The people in West Virginia, the only health care they had before, the 175,000, John, was they had to go to the emergency room. Well, if you gave them now a health care card, and they're still practicing the same procedures they did before, they're using it at the highest cost. Can we help them be more and better as far as in tune to how to use it, better educated on how to use it? I'm sure there's energies, but not just throwing them off. Why does it have to be so mean-spirited? Why can't there be some compassion, saying, listen, here's how you can keep it, here's how you're going to use your health care. It's going to make you a better person. It's going to give you opportunities. That's what we should be doing.
Okay, Senator, we're going to have to leave it there, and we'll be back with 2 Senate Republicans to get their thoughts about the bill.